Hello, everyone, and welcome to the training webinar for the data entry system for the Pediatric Readiness Quality Collaborative. Our presenters for today will be Dr. Hillary Hughes and Eddie Zamora with the NEDARC team. And what we want to do is start with a couple of announcements. So today is a very major milestone in the course of this collaborative. We have finally reached the implementation phase. And as a reminder, during this phase, which will last for the next, we'll say 9 to 12 months, teams will be declaring their site-specific aim statements. You'll be rolling out your interventions based on those bundles that we had the deep dive in during summer of 2018. We will be evaluating your performance using quality measures and then providing feedback that you can share with your care team regarding your performance. As a reminder, the content during today's session should not be construed as the official position or policy of the entities that are listed here. Okay, Eddie, you're up.
Hi, good afternoon, good morning, everyone. We're happy today to be talking about the PRQC data entry system. We want to thank you all for your patience in getting to this point, and I also want to congratulate the sites who have their data use agreements in place and getting ready for this next step. So for today's session, we're going to do an orientation and demonstration to the PRQC data entry system. That includes bundles 1 to 3. We'll spend some time talking about the bundle 4, and that's going to be entered through the REDCap system, which is a web-based survey, a web-based system for survey and database management. We will be taking questions throughout the session. Questions can be asked via the chat box, and we'll also unmute it during the question slides. Everyone will be muted just to kind of facilitate the presentation. For those of you who are anxious to get your data entry going, you'll be getting an email regarding your user access. Now, in order to facilitate any issues that might come up on our end, we're going to stagger these in 3 stages. So today, we're going to send a set of emails. The email is going to come from our DCC support email, which I'll show you how that looks in a few minutes. And in the email, you're going to get instructions for setting up a password. You'll get the link to the PRQC website, and it'll also say which hospital you're associated with. So if any of those are incorrect, then please follow up with myself through that DCC support email or with Crystal Bartley. So yes, and let me see if I'm missing anything with the user accounts. And the people who are going to get this user email are those individuals that have completed a fully executed data use agreement for your site. And I think in order for us to have created those accounts, it probably would have happened about 2 to 3 weeks ago. So if you did send us a fully executed data use agreement in the last 2 weeks, you might not be getting it in this batch. So give us some time to produce those Active Directory accounts, but they will be coming. We had to generate a list for our IT staff to create. Any questions regarding this user email setup or process? And let me look at the chat box. Okay, if you have any questions moving forward, just drop a message in the chat box and we'll be talking further. Next slide, please. So in order to really start talking about our data entry system, yesterday we sent over an email on the user guide that we've created to help really support your data entry. This user guide is pretty extensive. It includes it includes all the sections that you're going to need to get started. So you don't need to log in to use this user guide. So we're going to place that link on the chat box. Crystal, if you can add that link on the chat box, that would be great for individuals who maybe didn't get that email yesterday. So Crystal will be adding that user guide link to the chat box, but then I'm going to show you a little bit of how that user guide looks. Next slide, please. On the user guide, I'm going to show you a couple things today. We're going to show you a section called Getting Started, which includes the system requirements for using the data entry system, reiterate kind of how to set up your, how to get our attention.
I'm sorry, Eddie, we had some interference. Can you repeat that for us?
Yeah, I was just saying that for today, we're going to look at the user guide and we're going to look at these different sections. We're going to look at the system requirements, we're going to look at the user accounts, how to log into the system, and then how to contact us when you have questions. And I also asked if you could add the user guide to the chat box, the user guide link.
And just to reiterate what Eddie said, you can access this user guide at any time, even if you do not have an Active Directory account at the end of today.
So I'm going to show you the user guide. So on the user guide, let me minimize that.
Can you guys all see that up on the screen now?
We can. Eddie, could you do a favor for us? Could you just, could you maximize the size of your screen and then maybe move the participants' pictures from the top? If not, we can work with it.
Okay, I will. What I'll do is I'll zoom in as we get to each section. That's probably the best way because we're maximized over here.
Okay.
So when you get access to the user guide, or when you access the user guide, what I would suggest the first thing you do is go to this Getting Started section. That will really orient you to being successful on the data entry system. Some of the things that we learned from our wonderful testers was what browsers are going to work and not going to work. So you'll probably be fine with Google Chrome, with Firefox, with Microsoft Edge, and with Opera. Some of our users had some issues with Safari browser, so I really wouldn't suggest you use it. And the application or the website will not work on Internet Explorer. So please, that won't allow you to do data entry. On setting up a user account, many of you that are going to get the account have submitted the following survey that asks you to designate a data steward. If you haven't done this at this point, I would do this to help you identify who those 2 data stewards are going to be on your site. And the link is right here, so you can click that when you need to. This describes a bit of our process for how we're going to set up a data steward account once we receive that information from EIC. Now, it will happen. Sometimes you'll forget your password. This location here tells you how to reset your password at any time. And we understand that sometimes there's turnover and the same data stewards that start today are not going to be the same data stewards 6 months from now. If at any time that happens, really, we suggest you contact Crystal Bartley so that we can move forward with setting up a new Active Directory account and also removing those users from submitting that information. And again, you'll get more detail on setting up your account when we send that user email, but this is a place where you can get some general orientation of how that process looks. Now, the link for the data entry system is PRQC.org. At the moment, you won't be able to log in because you don't have an Active Directory account, but I just wanted to point you to that. For today's session, I'm going to be using the test side, it looks exactly the same, but just wanted to point that out. And finally, moving forward, you're going to have questions, and we're going to try to support you in whatever way possible. There's a couple ways that you can get some help. In this user guide that we created, there's a search function in the top right, and there's a search function here under contact information. So if you have any question like, how do I close a baseline date, or what is bundle 1, or any issues that you might think come up, I would search it here, and you might be able to get a resolution that way. As users use the system and give us feedback, we're going to develop a knowledge base and FAQ that will be populated, and that will really support or enhance your use of this website. Finally, we have set up a TA or a technical assistance support email, and that email is right here, DCC_PRQC support at HSC. We'll be updating that there when we have it.
Hi, Eddie. Could you repeat that last statement? There was some interference.
Oh, I'm sorry. So we will be setting up a phone number to help support users when they're doing data entry.
And so just to reiterate, the first step, if you have any questions, would be to go to the user guide and try the search box function to see if you can answer whatever question you may have. Think of it as like a Google search. It'll come up with a list of different options where you can look for answers to your question. If you can't find an answer there, you can email us at the email address provided there at the screen. And then we're in the process of setting up a phone number that will be posted to this site as well that can be used if either email or the search function don't work.
Okay, so before we keep moving forward, does anybody have any questions? And if you, Chris, if you can unmute the line, that'd be great.
Okay, all of the callers are unmuted at this time. Go ahead, Eddie.
Okay, if anybody has any questions, I just wanted to give everyone a chance at this point.
Hi, this is Wendy at Clear Lake Hospital.
Hi, Wendy.
Hi. Actually, it's not a question so much as I can't seem to get onto the WebEx meeting.
What I'll do is send you today's slides via email so that you can follow along there, and I'll resend you the link for today's session. What's your name again?
Wendy Bisaccio.
Okay, I gotcha.
Thank you.
Can you do the same thing for me, Erica Adams from Blue Mountain Hospital?
Which hospital are you with, Erica?
Blue Mountain Hospital.
Blue Mountain. Okay, gotcha.
Yeah, computer systems help.
Okay. Okay, Eddie, go ahead.
Okay, so I'm going to keep moving forward. If you have any questions, please add them to the chat box, just to respect everyone's time here. So on the data entry system, we're going to be talking about the 3 bundles. You're all pretty familiar, but we thought we would put them up there. For bundle 4, disaster planning, that's going to be via RedCap. So let's get to the data entry system. I'm sure all of you are excited to see it. So I'm going to log out of here. Again, I'm using my Active Directory account here.
This will be the login screen you see every time when you go into it.
And you'll see on the top that, let me close this. Move it out of the way. That's going to close. You'll see on the top that it says test. So on your side, you'll be using production. So that means any data that you enter is going to be the data that is taken and stored. So I want to first orient you to the different sections that are located in what is called the workbench. So if any of you recall Yahoo from the Yahoo homepage from maybe 15 years ago, there was a widget homepage. This is what this is. It's a homepage where everything, where you can get directed to. Now, some of the data stewards are going to have access to multiple sites for data entry. If that is the case, you'll have to select the site that you want to enter data for. So in this case, I have 3 sites. I have Medical City Fort, it's just a test. I have Test 3 and Test 4. So before doing any data entry, you have to select a site. That is this is area 1. In this section over here on the right side, what we call area 2, we have access to the PRQC dashboards. We'll be doing a training on that at the end of the month. We have access to the Bundle 4 RedCap. So it'll just be a link to the RedCap data entry system. Not to confuse you, just the RedCap system. You'll have a quick link to the PRQC user guide, and then you'll be able to log out of here. The nice thing about these links is they all create a new tab. So if I click the PRQC user guide, it creates a new tab. So it doesn't take away from my ability to log in. These next 3 boxes here are these mini dashboards that we've created. So in this example, we haven't entered anything. So for Bundle 1, it tells me that it's not active. There's no records that have been entered. And the same for Bundle 2 and Bundle 3. I can show you an example that has some information in it so you can get an idea of how it might end up looking. So this is Test 4. On Bundle 1, I've opened up a baseline. I have an active baseline. And if I hover over this, you'll see that I've entered 28 records. I'm going to go back to the clean one to make it easier for us. This box here are what we call active records. So it shows open records that are completed but have not been submitted. So the best example of this is going to be Bundle 3, where you might need to wait for some information. So you might end up saving a record and be stored. If you submit a record and complete it, then those records are not going to be visible here. Now, the bottom, this active record box is where the system patient record number is stored. Now, if you remember from our conversations in the past, the system patient record number is the number that identifies that patient that you're entering data for. Now, we don't know who that is, but that number will be helpful for you to reference if you need to find out who that patient was.
And it's a randomly generated number, so it's part of the way we're protecting patient health information. It's not linked to any patient name or birth date or anything like that, and it'll be generated by our system with each record you enter. And Eddie will go in a little bit more about how to track those patients, where you keep a list of the record numbers matched to the actual patient name in your own hospital for future reference, but we will never know the patient name.
On the bottom left box right here, it's called Baseline Cycles and Local Policy Information. This is the section, and I'll go into this in a few minutes, where you're going to enter your baseline or PDCA cycle, or where you're going to close it. So where you start and where you close baseline cycles. It's also going to be the place where you enter a local policy and guideline that you have in place for that bundle. On the right side here, before you do any data entry, you need to select which bundle you're creating a record for. So Bundle 1, 2, and 3 are listed here. These are not going to be highlighted or clickable until you've set a baseline date for any of these. So I'm going to get us started. For today, we're going to be using, going back to the user guide, we're going to be presenting the demonstration in these 5 steps. So if I were a new user and I was going to start with data entry, the first thing that I would want to do is set up a baseline or a PDSA cycle. So I'm going to demonstrate how to do that right now. The second step would be I would enter information regarding the policies and guidelines. And you would need to do that after every cycle or at the beginning of every cycle. You would start, you would get to entering data, and then you would close a baseline or PDSA cycle once you reach 30 records. And finally, you would repeat the step, and eventually you would review the dashboards when you have some data populated there. Again, these are the steps. These are the steps that really require that data entry system. PDSA cycle, entering the policies, finally entering the data, which is where a lot of your time is going to be spent, and then closing the cycles, and then repeating the process over and over, depending on how many bundles you're working on. So let me show you how to start, how to set up a baseline or a PDSA cycle. So I'm going to do it on test 4. I'll do it on test 3. So for this one, I'm going to go to baseline, PDSA cycle, and selection dates, the bottom left here. And when I get here, I'll have 2 options. It will tell me which bundle do I want to enter a baseline or a PDSA cycle for. So in this case, I'm going to do weight in kilos.
And that, hopefully your hospital's already decided which bundles you're going to be working on. And some of you guys might already have been collecting data on the paper forms as you've been waiting for the system to go live.
And you'll want to make sure that the baseline that you set is before any of those patient encounters you plan to enter, or else you're going to get an error in the system.
So this is really important. The baseline start date needs to be a date and time that occurs before any of the actual patient encounters in your emergency department.
Or the patient arrival date, I guess.
Yeah, patient arrival date.
So I'll start a baseline, and I'm going to put January 1st, to be safe, January 1st, 2019. And once I feel confident about that, I'm going to press Start Baseline. Now, at this point, you can look on the right box, and you can see that my red font turned blue. So now I have an active baseline that's set. When I'm ready and I can close this, and I'm going to go back to my workbench. Remember, my workbench is at home place. I'm going to go back to my workbench, and I'm going to go to test 3, which is the site that I'm entering data for. Yeah. So there's a slight bug right now where if you're entering data for multiple sites, it defaults to the original one. So that's something we're going to have to fix. So we are working on test 3 today.
So just make sure if you're entering data to multiple sites, if you start to use the system soon, always double check the site you're entering data for. Every time you put in a new record, just make sure it's the site you want to be entering data for.
Yeah, we'll probably we will in the next version of updates we'll probably. So now you see that on bundle 1 I have baseline active. So we have a question from Kelsey. Let me see here. So Kelsey is asking, I'm confused about how to know which site to enter data for. So most data stewards are only going to be assigned one site.
One hospital.
One hospital. So for most of you, it's just going to say Medical City Fort Worth, St. Elizabeth. There's a few data stewards that are, especially for the network hospitals, that are going to be given access to multiple sites. And those are the very few people who have that situation where you'll have to be careful.
Most of you won't even have a drop down there. It'll just pull up your hospital site where it says select site, and you won't have any other options.
Exactly.
So you won't have to worry about which site you're entering data for.
Exactly. And the reason we have so many is because we're just testers. Thank you, Rachel. Yep. Thank you. Okay. So once you set a baseline, the next step is going back to this box here, and you got to set a local policy and guideline information. So you'll have three options: bundle 1, bundle 2, bundle 3. So we've been working on bundle 1, and I'll address your question, Elizabeth, right now. Maybe that's a question for Crystal, actually. So you need to set whether you have a policy in place for that particular bundle. So the question I have here is, do you have a written policy or guideline regarding weighing patients in the ED? I'm going to say I do. And I'll give it a policy name. We'll call this weighed kiddos in kilos. And the policy apparently has specified that the weight must be in kilos and it must be recorded in kilos. And then I press submit. Now, before you press submit, you have to be aware that once you commit to this policy, you won't be able to change it until the end of a cycle.
And there's no right or wrong answer to this. It's just whatever your hospital currently has in place. If you do not have a policy in place, just hit no, and that can be one of your SMART aims, or one of your goals is to have a creation of a policy for your site that would weigh kids in kilos and record kilograms only in the medical record.
So I'll press submit. And then it's on the right, I'll get a little box that says document has been saved, and I can just press close here. If I wanted, and if I was doing multiple data entry, I can go and enter another policy for another bundle, or I can keep it simple and just move on. So I'll go back to the workbench. Yeah. And I want to address that question that came up before we keep moving forward. So the question was from, Cassidy just answered it, but I'll read it out for the group. Elizabeth Diaz was asking, how do you know what to make your start date for data entry? Cassidy, or EIC, has responded that the start date for baseline should be the date the baseline cycle started, not when you started entering data.
So it would be whenever your site, and I know that, again, some of you may have been already gathering some information on those paper charts that were provided in PDF form. If you have been, then you would enter the baseline date, the day before the first patient encounter that you are recording. If you plan on using some baseline data that you're looking back over the last month to get your charts for your baseline cycle, you would enter the date, a day before the first chart that you're going to be recording. This becomes more important when you start your PDSA cycles. So you want to, once you close your baseline, once you get your first 30 charts and you've finished your baseline and close that and start your PDSA cycle, then you're going to be moving forward. And you want to set your PDSA site start date as that first date where you're now gathering forward-moving information to look for changes that you've made in your policy and guidelines. Correct me if I'm wrong, Crystal and Kate, please.
You've got it right. This is Crystal. Kate, I'm going to unmute you just so that you can chime in at any point.
Thanks, Crystal. Yeah, I don't have anything else to add. That's correct, Hillary.
We're just scrolling through to make sure we addressed everything in the...
Yeah, Rachel Ford is just saying she received guidance from EIC that January 1st, 2018 is the earliest day for baseline date. Yeah. That's correct, and that's how our system is set up. So if you try to enter information before that, it probably won't let you. And you'll need to do 30 charts, correct, before you can switch out of a cycle. Again, you won't be able to move forward from like baseline to PDSA cycle 1 until you've completed those 30 records. And depending on your volume, that may be more or less for your hospital.
Yeah. Some of you may need to go back to January 2018 retrospectively and try to find those 30 charts for baseline. Some of you may have high enough volumes that you could go back a week.
Yeah. So at this point, once you've set your baseline cycle date, once you've entered a local policy or guideline that you have in place, you're ready to start entering data. Now, for this step, we're gonna do a demonstration to show how to go through that data entry process. So I'm gonna close the chat box and I'm gonna hand it over to Hillary.
Data into a baseline cycle for PDSA cycle 1, or excuse me, for a baseline cycle for bundle 1. So remember, for each time you enter a new record, the first thing you need to do is select what bundle you're going to be working on. There are some sites that may be working on more than one bundle, and we'll talk about how to enter data for 2 bundles at once.
And one thing that I wanted to add, if you notice where like Hillary's mouse is hovering, only weight in kilos is activated right now. So
I can't mess up because I've not opened the other bundles at this point, but you may at some point have multiple bundles open. So you want to select the bundle you're planning on working on and then click on Create Record. This is going to bring you into the actual patient information data entry pages. So you'll see here for each bundle, it'll ask questions, and some of these questions are the same for different bundles, which is why you can sometimes do multiple bundle entry, and again, we'll demonstrate that in a minute. The first thing you're going to see is the system patient record number. That's that unique, very long number that helps us protect patient information. You want to make sure that you write this down, and Eddie will show you an example of an Excel sheet that was sent out, and have it correspond to the actual patient name and other identifiers that you're keeping track of in your own hospital. For mode of arrival, for all of these you can see there'll be a drop-down menu that'll come out. You can choose how this patient came in. And for your reference, there are some of these data points that are required and there are some that are optional. Most are required, but if you do have any questions, you can find out what is optional and what is required in the wiki guide, the user guide. So let's say that we had a patient come in by ambulance, and that can be air or ground. And we're going to say that the date of arrival was March 1st, 2019. And this patient came in at just after midnight. And we'll say that this patient was a year-old kiddo. So let's drop down to March 2018 and make this a year-old baby. And the next thing you're going to enter is the triage level. So everyone has different ways of doing triage at their hospital. We know this does not capture every option of triage, but we're hoping people can kind of figure out what it's closest to. So most people have a 1 through 5 or a color triage. 1 usually corresponds with red, 2 with orange, 3 with yellow, 4 with blue, 5 with green, or a similar type of color scheme. So just do your best to pick what kind of triage code works best for this patient. We've also listed some colors, and these correspond more with the kind of start disaster triage, but they do follow some of the other standard triage. So I'm going to say this patient was a yellow, or it could have been a 3, would be the equivalent, and enter my triage level. I'm going to scroll down, and you can see here, this is something you do not have to enter on every record. This will show you whether or not you have a policy in place, the name of that policy, and when you entered that policy. You do not have to change this, and in fact, you can't change this as you're entering the patient data. It's just a reminder to you of what your policy is currently. So the next thing we come to here is our vital signs, and it's asking if there's a wait in the medical record. So I'm going to say, yes, we had a wait. If I hit yes, you can see this next box comes down. There's some stuff called skip logic in this database where things will open depending on if you say yes or no. If I had said no, you can see I don't get another option to enter more information. But I'm going to hit yes, And it's going to ask me how I measured that weight. Did I use kilograms, pounds, or both? I'm going to say, because I have a policy up here that I weigh my kids in kilos, that this patient was weighed in kilograms. And I'm going to say this was a 10-kilogram child, a 1-year-old. As I keep scrolling down, the next section it asks about are whether or not there were any medications administered. And if we think back about why we care if kids are weighed in kilograms, we're really trying to make sure we're helping reduce medical errors. And we know that weighing children in pounds can lead to medical errors, especially because medications are kilogram-based dosing for most pediatric formulations. So this question will ask me, are any of the target medications administered? And this list was chosen because most of these, pretty much all of these medicines have a pretty specific range per kilo that can help us determine whether or not there was too much or too little medication given. So we'll say this baby came in with a fever and got some acetaminophen or Tylenol. And what else do we say? We're going to say this patient also had some pain and got some morphine. So each time I click on one of our target medications, it will open up a box down here asking for my dose. If I had not selected any medications, if this patient came in and did not receive a medication, these boxes would not open and you would not have to enter any dosing information. But let's say I gave this child 150 milligrams of acetaminophen, and it'll give you an option of how it was given, either oral or rectal. I'm going to say this kid got oral. And again, the routes were chosen just by the most common routes these medications are given. For morphine, I'm going to say we gave the baby 0.2 milligrams, and we gave it IV. And this first bundle has the least amount of data that requires entry. So I've actually finished this record. I've completed everything that I need to fill out in this first record, all my arrival information, whether or not this kid was weighed in kilos versus pounds, any medications that were given, and the doses. The most important thing to do is very frequently save your work. This program does not automatically save information. So without saving, it will not save it for you automatically. If I want to complete this, if I look through it again, I've double-checked my work and I feel like everything is correct and I don't need to make any changes, then I can complete my selected record, this red box, or excuse me, the green box. Once you complete a record, you cannot go back and edit it. So it's really important just to do a quick double check and make sure you feel that the information is correct before you complete the record. You can save it any time. You can go back to the workbench and come back to it, and we'll show you how to come back and edit it. But once you complete it, you cannot re-access it. So I'm going to feel like I feel confident about my information. I'm going to click weight in kilograms, and this is going to be more evident why I need to do that when we do multiple bundle records. But they want me to tell them, the system wants me to tell them what bundle am I saving this record into. So right now I only have one bundle open, the weight in kilograms. So I will put weight in kilos, and I'm going to push complete selected record. And then it's that little bug that Eddie was talking about, sorry, but you can see for test 3 now, I've done one record. I can hover over it, and it's showing me I have one record complete. I'm 3% of the way of getting to my 30. Yeah, that's the most simple example I'm going to give, so let me stop right there and just see if there's any questions that pertain to that more simple process of entering a record before we move on to some more complicated demonstrations.
And I unmuted the lines for you, so anyone can speak up at this time and ask questions.
So Lisa Anderson was asking us earlier if you can download the system patient record for multiple visits entered. There will be an export function for records that have been completed, but that was a later feature request, so that will be coming.
And if their same patient comes back multiple times, our system will generate a new system patient record number for each visit. Part of the reason it does that is we're looking for individual visit data points, not for patient trends over time necessarily. So for each visit, we care how the patient was weighed and if the medication dosing was correct. We're not looking at patient trend over time. And again, correct me if I'm wrong, Crystal or Kate. So each patient visit will have a unique system patient record number, even if the same patient comes back to the hospital multiple times.
That's correct.
Yeah, and Diana could clarify that you can have multiple patients being entered for multiple bundles.
Yeah.
But it helps to have it in the same time range.
Yeah, and what we'll show you, I'm going to do one more scenario, and then we'll show you how to do a data entry for 2 bundles at the same time.
Okay, we're gonna keep moving forward.
All right, so I now am going to try to show you guys how to work through bundle 2.
Oh, it's still bundle.
Oh, sorry, bundle 1, but this time I'm going to give you an example of how to stop and save your work and then come back to it and finish an entry. And we're also going to maybe throw in an error just to show you how that happens. So again, I'm going to come down here. I'm going to click on weight in kilos to create a new record. It's going to bring me to my patient level screen. There's my new system patient record number for my new data entry. This time I'm going to say I had a child walk in through triage, which means they came by their own private vehicle or a bus or a taxi. We're going to use the same start date because why not? It's fun. This kid also came in on March 1st. And we're going to say this time they came at about 8 a.m. This child was born, we'll say September 1st, a little 6-month-old baby. And this triage level was green. So in triage, they did not feel this child was very sick. And oh my gosh, I just got called off to go do something else, so I'm going to save my work so I don't lose it. And I finished whatever thing they needed me to finish. 30 minutes later, I'm able to come back. And let's say I come back to my workbench, and I'm sorry, this will not happen to you. I have to go back into test 3. This will not happen to you. It'll just be your site. I can come back to this record. So I'd written down this number because I'm being very proactive and making sure that I'm writing down each number for each name. And I verify this is the child I was working on. And I'm going to go back to my record. You can see here it's showing me I'm only entering data for bundle 1 on this child. You can click the green arrow, and it'll bring you back into that record. So now I'm able to go down and finish my data entry. We did not administer any target medications. Okay, and I'm going to save my, or I'm going to go, I want to complete this record now. I don't want to get called away again before I'm done, so I'm going to complete the record. This is what an error message looks like. So if you have an error somewhere, you're going to see that red box with the exclamation point come up, and there should be a little information, I'll pull it up again, that tells you what you did wrong. Sometimes it's not 100% specific, but you can usually get an idea of where you need to go back to. So in this case, I didn't select which bundle I want this record saved to. I need to select weight in kilograms and then hit complete selected record. Let's pretend I made another error. Let's say that my date of arrival, I put March 1st, 2019, but let's say I had this child birthday is March 4th, 2019. So the child is born after they arrived. If I go to save my work, I can still save it with the error, but when I go to complete it, you see these boxes come up. I'm going to try to pull it up. They don't last long. Could not close the bundle, check all required fields. So if I scroll up, I'm going to look for red, and it'll give you a hint of where the error is. So on date of arrival, it says date of arrival is before the date of birth, and I go, oh, well, that's silly. I really meant to put, you know, whenever I'd said September or October, whatever I'd said the date of birth was. So I can correct that. I've listed what bundle I want this saved under, and I can now complete my record. So anytime you see a red box flash up, look for those words. If you can't tell what it's asking you to do, scroll up through your chart, and there should be red writing where the error occurred, and hopefully you can figure out what you need to fix. As you can see now, if I hover over this little mini dashboard, I've completed 2 records in bundle 1. So we're going to move on to more and more complicated demonstrations. This next one, we're going to do an example of how you would do 2 different bundles at once, enter data for 2 bundles at once. But before I can do that, I need to open my baseline cycle for bundle 2. So I'm going to go back to my workbench, click on baseline data. I'm going to select abnormal vitals, which is bundle 2, and I'm going to start my baseline. So again, to be safe, we can go back way in 2018 to make sure all records come after that date, and I can start my baseline. You can see I now have both weight in kilos and abnormal vital signs baseline active. I can close that.
Can you go back to that, Hillary, real quick? Sorry.
So
you can, and at any time, let's say that you forget what baseline date you have set or PDSA cycle date. If you click on Edit Baseline, it will show you what baseline date you have set, and also if you need to edit it for some reason.
You can, and then just justify why you edited it.
And then you could do the same if you bring up the weight in kilos. You can also see that one. Go back up here. You can also see that one, and you can also edit here. So if you need to see on side by side for some reason, you can see your start dates on both.
And if you click on this box by accident, just push Cancel Editing.
Yeah, that's what.
All right, so now I'm going to go back to my workbench. So I look up here. I have, sorry, this won't happen to you, but I have bundle 1, baseline active, bundle 2, baseline active. I didn't put my policy and guidelines in for bundle 2, so let's do that real quick because we talked about needing to do that as well. So I'm going to say I don't have a policy at this point for abnormal vital signs. That's something my team needs to work on. I'm going to close that and go back to my workbench. Okay, so let's show you guys how to enter data for 2 bundles at once. You can see now I'm able to enter data for weight in kilos and abnormal vital signs. I'm going to select both. I'm going to push Create a Record. This will make it so that you don't have to enter the common data points for the 2 bundles. Each bundle has some unique data points that you'll enter, but you won't have to put things like the triage date and date of birth and weight in kilos and that kind of stuff for each bundle. It'll save it for both. So in this example, let's say we have a kiddo come in by ambulance. We really like March 1st, so we're going to choose that again. The time of arrival, we'll say that this child came in at about 2 p.m. And the kiddo's date of birth, it's going to be a 3-year-old, so we'll choose, we're going to go way back to June 2016, or January. We'll make it almost a 3-year-old, say April. All right, for triage level, we assign this child a yellow or a 3. And you can look down here, again, this is stuff you can't edit, but you can see I do have a policy for weight in kilos. I don't have a policy for abnormal vitals at this point. Was the weight in the medical record? I'm going to say yes. And then it's going to ask me again, was this in kilos or pounds or both? And we'll say both. And then I'm going to have to enter both the kilogram weight, which we'll say was 14.2, and the pound weight, which we'll say was 31.5. The triage time, this is important when we talk about vital signs. So this was not an element that was on bundle 1, but it is on bundle 2. And so again, we're saving common elements here. So triage time, let's see, we said this kid came in at 2 p.m. We'll say they were triaged at 2:10. And the date of triage should carry down from what you were entered earlier. You can double check. I said 3:1 is when they arrived, and 3:1 is when they arrived. So it's a way to it's also in bundle 2, although in bundle 2 you don't have to enter the doses. But if I click yes, the target medication was administered, it again brings up that list of standard medications that have standard dosing. We're going to say in this case this child had low blood sugar, so we gave some dextrose. and maybe had a fever, so we gave some ibuprofen. And then it's going to ask you for the doses. So for, and we'll say maybe this child is dehydrated. Let's give some saline too. So for dextrose, we'll say this kiddo got 40 milliliters, and for ibuprofen, got 200 milligrams. And I'm looking through the chart, and it looks like they got a 200 milliliter bolus of saline. Some of these only have one route option, so you don't have to choose. These three happen to only have one route option, but remember, sometimes you will have to choose if it's IV, oral, rectal, intramuscular, or intranasal. Those will all be options that are possible with certain medications. All right, so we're going to keep scrolling down. You're starting to see now some of the elements that we collect for Bundle 2. These were not in Bundle 1. These have to do with vital signs. So time of collection of first vital signs. This should be around the time of triage. So this kid, we said, got triaged at 2:10. So we'll say at 2:11 they got the first vital signs. That date, again, should follow down. And then heart rate assessed. I'll say yes, there was a heart rate recorded. Was there a respiratory rate recorded? Yes. Pulse ox, yes. Mental status, no. Home safety assessment conducted. If you can't find a record of that, you can just hit no. Blood pressure,
Hillary,
we'll say we did.
Hillary, I got a question for you. What if
Yeah.
the route option is not listed?
There will always be an option. Sometimes it'll auto-populate if there's only one option. So if oral is the only option, it should auto-populate as PO. If IV is the only option, it should come up as IV. If it's a medication that has multiple route options, then it should come up as a drop-down menu for you to choose.
And so, JJ, is your question about whether it's not an option that's listed in your medical record, or were you inquiring about the data entry system? Okay, go ahead, Hillary.
All right, so it's asking about all different types of vital signs, and we consider pain and mental health. Sometimes are considered vital signs, so that's why we're collecting some of this. So we'll say they got a temperature, got some pain assessment. They didn't ask about mental health. And as you come down, this is where we get into what we're really looking at in this bundle. The question for the first set of vital signs, did all vital signs fall within standard normal ranges based on site-specific guidelines? So if I don't have a guideline, I'm going to click no. If I have a guideline and the vital signs all fell within normal, I can click yes. If they didn't, I would click no. So I'm going to click no just to kind of show you guys, or this one doesn't have any type of drop down with it. So I'm going to say that we don't have a site standard range because I did not have a guideline yet. This one I'll just kind of alter what we said before, but does your site have a process for abnormal vital sign notification? If I hit yes, it goes to that skip logic and it brings up another question. Did any of the vital signs meet the threshold for abnormal vital sign notification? If I hit yes again, it's going to bring up more skip logic, and it's asking you, did someone get told, did a doctor or a nurse practitioner or someone get told that these vital signs were abnormal? If you can't find documentation of that, you can put no or unknown. If you do see documentation that physician was notified about abnormal vitals in the nursing records, that's great. You can hit yes. If I'd come back up here and hit no on this first one, that we don't have a process for vital sign notification, you can see those following skip logic questions would never appear. So because at this point my site does not have guidelines for vital sign notifications, I'm going to leave it as a no. All right, and then we're going to go down to interventions. So this box is really looking at, hey, if a kid had abnormal vital signs, was anything done about it? So it's asked, the first one it asks is there any airway intervention? I'm going to say there was no airway intervention. This kid did have an IV placed because we gave some dextrose. If you remember, we went up here, we gave dextrose and normal saline. So I'm going to say yes, there was an IV placed. And it would like to know what time your IV was placed. So let's say we put this in at 11. Okay. So were any target medications administered? This is a little redundant with what we already answered, although this time we don't have to put in the doses. So we did dextrose, ibuprofen, and normal saline. It does want to know about fluid, and that goes back to recognition of sepsis because we're trying to capture how quickly a child got IV fluids if they had a really high heart rate or low blood pressure or other signs and symptoms of sepsis with their abnormal vital signs. So if you have saline, they will want to know what time you gave the saline. So let's say we gave it at 2:30 or so. And then it will ask about blood products. I'll say this child did not get any blood products. Oh, sorry, I forgot. Eddie just pointed out, I almost made a mistake there. So it wants to know the time, the date of administration. This kid was here on the 1st of March. That one does not carry over from your initial arrival and triage date because sometimes these kids sit in the ED for a while and they can cross midnight. So we want you to re-enter the date at this point. All right, it also asks you for your disposition for bundle 2. So here are your options. You can be admitted to the floor or the ICU or to pass away, but all of these options are listed here. So you can pick which one pertains to your patient. I'm going to say this child was admitted to the floor. And then it asks for your diagnoses. So this is one of those places where we have optional information. We do ask you to provide at least one diagnosis, but the ICD-10 codes, if you can't find them, are optional. So I'm going to say the first diagnosis I'm going to give this child is dehydration. Oh, I'm having some typing issues. And I just happen to see the ICD-10 code associated with this on my chart, and so I can enter it. And then the second diagnosis given to this kiddo is fever. And that one, also I have a nice medical system where it pulls up these for me so I don't have to search for them. The third one is vomiting. And we've got all 3. And again, we only require one diagnosis. All the rest of this is optional, but we would love it if you're able to enter up to 3 diagnoses and ICD-10 codes if you have them. So I am going to save my work. And when I scroll down, say I look through everything again, I think, okay, I agree, everything looks really good. I'm ready to complete this record. Now you can see I have to decide which bundle I want to save this to. Have I completed this for both bundles or just for one? I'm going to say I'd like to save this for both bundles. So I'm going to click on both bundles, and I'm going to complete my selected record. All right. I had actually put an error in there that it didn't catch, so we'll deal with that. Yep. There's supposed to be a flag that came up because I put that the child got an intervention before their triage time, but we'll deal with that. So that is how to do 2 records at once, or a record from the same patient into 2 bundles at once. So now you can see if I hover over bundle 1, there's 3 records. If I hover over bundle 2, I have 1 record complete. Bundle 3 I've still not opened, and so it is not active on its cycle.
And when you start working on bundle 2, specifically, there's so many dates that's really where you are going to get more errors. Because the system kind of forces it, except for what happened now, but it generally forces it to be logical. It's like everything has to happen after that arrival date.
Yeah. All right, so I'm going to walk you through one more scenario and then turn it back over to Eddie. We're going to do something, I'm going to walk you through bundle 3, which is a little bit more complicated. So bundle 3, again, I need to start a baseline date before I can enter any data into it. So I'm going to go and I'm going to choose interfacility transfers. I'm going to start my baseline. And I'm going to set my baseline date as March 2018. I'll pick a random day and start my baseline. And if you ever need to see that date, you can click on this. It'll pull up your date. You can cancel editing if you did it by accident. So now you can see all 3 bundles are active here. They're all in blue. I can go back to my workbench. I need to put in my policy and guidelines for bundle 3. I'm going to say that, yes, we have a policy. My policy name is transfer kids. And we say we need to have initiation of transfer. We need assigned consent. We provide directions to the family. We provide recommendations of mode of transfer. So you can choose all of these that apply to your policy and then submit. Sorry, we're trying to figure out why it's giving us an error. Let's try it again. Is it because it's in here?
Try to test it.
Sorry, we're just having issues because of this weird bounce test thing. Let me try to enter that again. We'll click on a couple of these, whichever one would pertain to my guidelines. Okay, now it's letting me do it because I was back in that test. All right, so I'm going to go back to my workbench. You guys won't have to choose up here, but I do. And I'm going to create a record for Bundle 3 or interfacility transfers. As always, you'll write down your system patient record number. You can see these all start with the way the patient arrived. So I'll say this patient arrived by ambulance. You always need to choose an arrival date. We'll choose February 15th. Time of arrival, we're going to say, let's say 1 a.m. Date of birth, we're going to make this baby a little baby, just a 2-week-old. And the triage level, we're going to say this baby looks sick. They're going to get a higher triage level. You can see here I have proof that I have my guidelines that exist. Triage time, we'll say this baby arrived at 1, got triaged at 1:10, and the date should carry down from up above. Now this bundle looks at our transfer guidelines and criteria and policies. So it's asking is, did patient meet criteria for transfer? I'm going to say yes. Was the patient transferred? Yes. And then ask, why did you choose to transfer this patient? So I'm going to say in this case, this was a 2-week-old, so my facility does not admit tiny babies, and this baby required critical care. Your other options are things like specific specialty, which might mean this child needed an orthopedic reduction by a pediatric orthopedic specialist or needed to see pediatric surgery. Interventions and procedures would be things like lumbar puncture or sedation for a CT scan. Mental health is kind of self-explanatory. If this patient requires inpatient management but your facility does not admit kids, trauma, whatever pertains most to your patient, you can choose as your reason for transfer. And then it'll ask your mode of left. This kiddo came in at 1 and left at 4 on the 15th, so just double check your date there. It asks if there was a delay in transfer and why. So I'll say there was a delay, and this time there happened to be some weather that made this delay. It asks for the option of whether a telehealth consultation. I'll say no in this case. And if you did do telehealth, you can see a drop down for what services you were using with telehealth. Then we get to, with this bundle, if any of your team has looked into this bundle, we're also looking for feedback from the receiving site and from the families about how the transfer process went. So the next part, and I'm going to save here and come back to this to show you guys, because in Bundle 3, a lot of times you'll be able to fill in this, but you might not have this transfer form back. So let's say I wanted to save, which is probably what you'll do commonly in Bundle 3. Go back to my workbench. This thing keeps popping out of the one we're using. And let's say a week later, I get that form sent back to me. So I'll go back to this record, and now I can complete my record. So remember, at any point you can save that record, and it will always be available on your workbench to come back to if you don't have all the information. So now I'm going to say I received this feedback form. The ED diagnosis at the other site where I transferred was neonatal sepsis. And I don't have their ICD-10 code, we can pretend. This is optional, you do not have to put in the ICD-10. Procedures they did there included diagnostic procedures like a lumbar puncture. And you can hopefully they will fill this information in for you. The disposition time, which meant when did they decide what to do with this patient? Did they admit them? Did they discharge them? I'll say they decided to admit this baby at 7 a.m. We transferred them at 4. And you're going to need to put in a date because we know sometimes kids can sit, especially with mental health complaints, can sit for quite some time in an ER. Part of the reason we're collecting this is to try to look at maybe preventable transfers who got discharged very quickly from another ED. But we're trying to see how long kids last in another ED before disposition after they've been transferred. And then disposition from the receiving facility. So again, once that child was transferred, what happened to them? And I'm going to say this child was admitted to the ICU at the other hospital. The feedback form, we're hoping will be filled out by the family as well, looking at how they perceive the transfer process. So I'm going to say this family did fill out the evaluation. They received the transfer packet and asked you for some scores, which will be on that form that's returned to you. So I'll say they felt somewhat comfortable with the reason of transfer, somewhat comfortable with the directions, and overall they were somewhat comfortable with the transfer process, which is probably being kind to a poor mom who has a 2-week-old baby. She'd probably feel less than that, but we'll say we did a really good job. So now I've almost finished our bundle 3. The only thing left is our ICD-10 codes. And these are the codes from your hospital, from the referring facility. So we're going to say that when we sent this baby, we thought there was fever in neonate, and we were able to, our records show us the ICD-10 code. And we'll say that there was respiratory distress. Remember, only one diagnosis is mandatory, and the ICD codes are optional if you have them. Right. So now, let's say I looked back through my record. I feel like it's complete. It'll show you down here where you can save this. If you had entered this record for multiple bundles, you could pick more than one bundle, but for this one, first I'm going to save, because we always save. I'll just choose interfacility transfers, and I'm going to complete my record. So I didn't get any errors. So if we go back to my workbench, you can hover over here and now see that I have one completed bundle for bundle 3. So we walked you through the 3 bundles and shown you an example of each. Hopefully you can see that it's pretty easy to enter the data. And again, we know some of these have a little bit more tricky parts to them, like doing 2 bundles at once. Please refer to that user guide if you have any questions come up. And you can always save your work and go back and edit. Don't be afraid to save and play with it a little bit and make sure things look good before you complete your record. I'm going to turn it back on to Eddie. I know we're running short on time, but we're going to move for a few more things and then turn it over to Crystal.
So all I really wanted to know was how to close the baseline. So we mentioned that you needed to have 30 records complete. So I'll show you an example where you've almost completed a full cycle, and now you're ready to go from one cycle to the next. So in this example, I'm bringing up another test site. And if you look on the left side, we have 28 records that have been submitted for a active baseline cycle. And on my workbench, I have 2 records which I saved and I need to complete. So once I complete these, I'll get that 30. So let's go and finish this record really quickly. So I'm just gonna put in some information, some data. I'm gonna complete that record. Okay. Let's go back to test 4, which is the one I'm using right now. So now I have 29. All right, let's complete the last one to get to 30. And in this case, I'm just putting in any information. I'm just trying to show you that example. So I don't have any weights and medical records, no medications were administered, and I'm going to complete that record. So now, if I go to test 4, you'll see that I have 30 records. At this point, I can close that cycle, and the way to close it is the way that Hillary has been showing. As we go to this bottom left here, we're end here. We'll have to set what our baseline end date is. So I'll put today's date, and I'll put end baseline. So now you'll see that my baseline has been closed. At this point, I'm ready to reopen another cycle. So let me show you first, though, how my workbench looks, because that's helpful to see. So you'll see now that my bundle 1 is not active, and it's completely blank again. So now I'm going to go back to my baseline PDSA cycle and selection dates. I'm going to select weight in kilos. And now you'll see that my options are that I can start a PDSA cycle. So now I have that option available. So I'll make it and then I'll be able to select the key drivers that I'm working on for this period.
And hopefully, again, each time you're getting close to completing a baseline or a PDSA cycle, hopefully you and your group have worked at setting your SMART aims and your key drivers for the next PDSA cycle.
And in this case, for this cycle, I may decide that I'm going to be working on guideline statements and, let's say, patient and family engagement. I'll set a PDSA cycle start date of April 2nd, 2019, and I'll start the cycle. Oh, so it says here, the starting period has to start after. So since I closed it today, it needs to start tomorrow. So there it is. So that means that if I closed a cycle on April 2nd, I need to start a cycle on April 3rd, just the way we have coded it. So now, like earlier, you can see that now this color has changed from red to blue. And at this point, like you did earlier, you're going to want to repeat the process. So you'll want to set your local policy. If I go back to our workbench, you'll want to go to local policy and guidance information and set a policy in place. And please note that it is going to reset, so you'll have to, if it's the same policy, it's okay, but you'll have to re-input it every time that you start a cycle. My suggestion to users is to kind of write that policy down and write these questions down, so that you avoid, if you're going to have the same policy in place, if you don't think it's going to change that quickly. But you will have to set the policy again before you move forward and start data entry. So going back to our order of tasks, so you'll see here now that it says PDCA cycle 1. So that means that you're ready to start once you've entered that policy. The system won't stop you if you don't have a policy in place, but we strongly suggest it, of course. So you'll see that today we've gone over setting up a baseline or a PDSA cycle. We've gone over how to enter your policy, your guideline. Hillary did a couple scenarios on how to enter data, either a single bundle data entry or a multiple bundle data entry. I quickly showed you how to close a baseline or a PDSA cycle and how to restart one so that you can go back to the beginning. At the end of April, we're going to do 2 Tableau dashboard demonstrations. So we'll be showing you how to take this data entry and then actually look at your dashboard data so that you can visualize the work that you're doing and kind of measure the progress. Again, those will be found in the PRQC dashboards link. You can access them when you get your user login, but it probably won't have any information until you start to populate it. So I wanted to show the group a few other things on the user guide, and then we'll open it up to some questions, and then we'll move over to REDCap. But let me show you a couple things that may be helpful as you start this process. So the one thing I wanted to show you first was how to generate a PDF for each bundle. So sometimes, depending on your workflow, you might need the actual PDF version. So let's say that you're in a clinic setting where you can't physically enter the data on the computer. You might want a PDF version. We've created these PDF versions that are downloadable. Let me close that really quick. So on the left side, you can do it. You can get here in 2 ways. You can go through the left side, look for bundles and intervention, and then drill down. So bundle 1, 2, 3, and 4 are listed here. Or what I just did right now is I just searched bundle 1, and I was able to bring it up. When you get to, we'll do bundle 1 as an example. So right here on bundle weight in kilos, you on your browser, you might be able to download it directly, or it might pop up like it did on my screen. And then you can scroll down and you can see that all the questions that we're asking are listed here. The ones in asterisks are the ones that are required. So if you need to know which questions are required versus which questions are optional, they're available here. And in this case, I'm going to take this with me. I'm going to save it, and I'm going to take it to my, I'm going to put it on my desktop so that I can use it and print it out.
And you could have, this would be a way, if you had an MA or someone who's willing to help gather this information for you, they could, but they're not a data steward who can enter directly into the system. You could have them gather it on paper, and then you could enter it later.
And they're also listed here on the website itself. So if you don't want to download them and you need a quick reference, you can view them here. Earlier. Oh, someone's losing audio. Can everyone hear me? Just want to make sure.
We can still hear you, Eddie.
Okay. Thank you. So the other bundles 2 and 3 are the same exact way. So I won't take too much of your time with that. Earlier someone asked about exporting data. So we are still working on this feature request. But if you need to double check the scenario with this, if you wanted to check what records were entered when you were, let's say, batching some data entry, you'll be able to export an Excel file to review it. At this point, I think the Tableau dashboards are going to be your tool to kind of look at what you've entered. And finally, earlier, Hillary alluded to Excel file for managing your system patient record numbers. So we created a patient record log, and I'll show you where it is right now, but let me first show you this. It's a PRQC data intersystem patient number matching log. So again, for ours, we're not going to be, we're not going to know which patient you extracted data from. This might be a way of you managing the patients that you've entered data, especially if, like for bundle 3 as an example, where that might be needed. So we've created that, and we can always provide more TA on how to use this specifically, but I just wanted to show you that was available. The way you can find this, I typed in patient log, and oopsie, and if you go to the workbench, it's right here. So download the sample template. So under workbench, and you can download the sample template. Again, I just used the search functionality because that's a lot easier for me. So just typed in patient log, and I was able to find it pretty quickly. But if you need to drill down, you go to workbench and you find it that way. And that is what we had for our presentation today. Moving forward, we can certainly answer questions via the DCC PRQC support email. We'll be setting up that phone number to further support you, and you'll be receiving that user email to set up your accounts. I know that we are running a little bit of a little low on time, so maybe we can have like a minute or two for questions before handing it over to Crystal to talk about REDCap.
Yeah, and Eddie, we're actually going to just go ahead and reschedule the bundle 4 for maybe next week at the beginning of the session, just because we don't have time today and we want to make sure that everyone gets their questions answered. So if anyone has questions,
that's perfect.
Go ahead and enter them in the chat box.
Okay, that's perfect. Thank you. Yeah, as we were preparing for this, we were not sure how much time would require to really like fully train all of you or provide support. So thank you, great. That's helpful.
And I promise you guys, it looks a little overwhelming at first, but once you enter a couple of records, you get the hang of it pretty fast, and it gets easier with time.
And one of our users has lost audio, so I'm just going to respond to her. Hi, Erin. It might be helpful to restart your WebEx.
We're excited for you guys all to start the process, and I hope you find the data system pretty easy to use. Please email us or contact us if you guys have any concerns come up as you start to enter your patient records.
And we know that there are a number of sites that are really interested in starting with Bundle 4. So what we will try to do is next week we will start with Bundle 4, and then we'll go back over Bundles 1, 2, and 3. So for those of you on today's call that we're really looking forward to hearing more about Bundle 4 and the disaster, we'll put that up front. And then no, we may go a little bit long next week just to accommodate all of the questions.
So there's two questions. There are three questions. So the first question was by Wendy Besacchio. She said she missed the beginning of the meeting because she was having trouble logging into the meeting. She's asking, are there any restrictions in the age restrictions in the baseline?
Yeah, so I'll take that, Eddie. Wendy, we did not define pediatrics. That is a bit of a can of worms to try to get into, because I don't believe any national organization has really gone and set age restrictions on what is or isn't pediatrics. So for the purposes of this, it is however it is defined by your institution. It might make more sense to choose patients that are on the younger side, so typically under 18, but you're welcome to enter any pediatric patients as defined by your institution. And then, Eddie, I'll let you take the next two questions.
Okay. Sherry's asking, when did you say you would be sending emails for the data stewards? So let me clarify this. So for sites that submitted a fully executed data use agreement a couple weeks ago, and we were able to get your data steward information, those emails are going to be going out today in 3 batches. So the first batch will go today, the second batch will go tomorrow, and the third batch will go on Thursday. At that point, we'll then, as the other users that have submitted DUAs get their data steward information in place, we'll be creating Active Directory accounts for them.
So if you have a fully executed DUA as of 2 weeks ago and you do not receive an email by Thursday afternoon, please contact us. If you've submitted your DUA in the last 2 weeks, give us a little more time because we're still making sure we have everything in place and then creating those Active Directory accounts.
There will be a delay, but reach out if you have questions, whether you're included in that email batch. Sherry, Wendy's also asking about how long is each cycle. Each cycle is up to 30 records. So if you have a high volume site, that may move faster. If you have a low volume site, you might be on that cycle for a bit.
Hey, Eddie, I'll jump in on this. So it's at least 30 records, and it really, as Eddie said, it really depends on the volume of your institution. But what we'll be talking about during the last 2 sessions of this month is the importance of being nimble and being able to go back to the dashboards and actually look at your performance. So if you haven't achieved a certain standard by the time you get towards the 30 chart mark, you might decide that you want to continue a cycle a little bit longer than 30 charts to make sure that whatever change strategy you implemented has been fully integrated into the ED. For other cycles, you might find that 30 charts is absolutely sufficient. So it's going to be variable from site to site, and it might even be variable from bundle to bundle or even from cycle to cycle. But it's going to be with you being able to go back to the dashboard, look at your performance, monitor it. The only caveat is that we are asking for a minimum of 30 charts per cycle.
Thank you, Kate.
Any other questions? You got it, Elizabeth. 30 charts per cycle. You're asking about 12 cycles. 12 cycles would be impressive because the change strategies can take some time to implement. You might find that just the implementation piece alone takes, a month. So you might choose a change strategy. It might take you 20 to 30 days to really implement it in the ED, and then another month to actually be collecting charts. So typically, for a given implementation, we might recommend no more than 4 to 5 PDSA cycles, and usually that gets you pretty close to the performance that you're aiming for. 12 cycles would be a lot. You certainly could go through them, but it really depends on your ED and your performance and your specific aims. Correct. So review one cycle. So review your baseline data, see where your performance is. Once you see that performance, you'll choose a change strategy. You'll implement that change strategy, and then you'll start collecting data based on that. And then you'll go back, look at the dashboard, see how your performance is looking, decide if you're ready to close out that cycle or whether you need to continue it, and back and forth. So about 1 cycle per quarter would absolutely be fine. And again, it just depends on the buy-in that you have at your institution, how difficult the change strategies are to implement at your institution, and then the number of patients that you have in your emergency department.
And then Erica wrote a question about abnormal vitals. If your site is doing sub-Q, Kate, I don't know your opinion, but I would just use IV as your option. We know that that's not exactly equivalent, but it involves a needle, so it's as close as we can get.
Yeah, I think that, sorry, this is giving me just a little bit of pause because this isn't something that we had officially discussed. Erica, let us get back to you on the sub-Q. I know there were a few questions about that. I think we just need to make sure that we're analyzing it correctly so that, if we look at this and, IV takes longer, but we notice that there are some patients that are getting sub-Q quickly and we're categorizing it as IV, it might change the metrics a little bit. So give us some time to get back to you on that. I actually might advise at this point, Hillary, that maybe if you're giving it sub-Q, you just don't include it, and that's okay.
Okay, we can ask, that would be hopefully a pretty fast fix, Kate. We could ask John.
Okay, that would be great. So if you're doing abnormal vital signs, how do you choose the best 30 charts? So again, the first piece is the data sampling piece, and it's based on numbers. And I know that Crystal really, dove into that a bit over the QI coaching sessions about how to do sampling. What I would recommend is that if you're doing abnormal vital signs, you want to look at those children that most likely have abnormal vital signs. So you might look at those patients who are triaged at higher levels, so maybe 1, 2, or 3, as opposed to levels 4 and 5 if you're using ESI as your triage system. And so then if you looked at, the number of patients that are in your ED that are triaged at levels 1, 2, and 3, it might be 30 patients a month, in which case you might sample all of those. And on the other hand, it might be 150 patients, recognizing you don't need more than 30, you might choose every 3rd chart or every 4th chart as a sampling strategy. So it would be helpful to go back through a month's worth of records or maybe even a year to see approximately the number of patients that you're seeing in a given month, and that'll help inform you as to how best to sample. And Erica, we see your comment, and we will work on following up on the sub-Q saline and let us know if we can make it, and let you know if we can make a fix to that. Any other questions or comments? Elizabeth, did I answer your question about sampling? Okay. If there are any other questions, please feel free to reach out to us. You're welcome to send us emails. Eddie also offered up support. If you have any questions regarding the data entry system, please don't hesitate to reach out to us. We will be doing this again next week. We'd be glad for you to join a second time if you feel it would be helpful. And as Eddie mentioned, the batches of those with fully executed DUAs will be going out over the next 3 days. Thank you all so much for your time.
Thanks,
any
everyone.
other final comments?
Oh, we appreciate it. Thank you. And we look forward to your feedback as we get this going. Have a good day, everyone. Good afternoon.
Thank you. Thanks, Eddie and Hillary. Great job with that.
Thanks, Kate and Crystal.
Thank you. Stop sharing my screen now.
Kate and Crystal, are you guys still there?
Yes, we're getting ready to disconnect. Give us just a minute.
Do you want to just, before we do it next week, we'll send you an email to see if there's any changes you want to make, or I have to run back to the hospital. I just left my shift, but Eddie will send you out a little email here in a sec.
Oh, great. Thank you.
Thanks, guys.